Hi, my name is Dr. Soni Singh, and I'm a gynecologic surgeon. This video is made to help you plan what to expect after your surgery with respect to pain management. First and foremost, talk to your surgeon. What kind of pain do you expect depending on the route of the surgery? We're going to talk about laparoscopic surgery. And the general reason we do this type of surgery is to reduce the post-operative recovery and reduce the amount of pain. So in our practice, if you've had a laparoscopic surgery, and that can include a laparoscopic hysterectomy, laparoscopic removal of endometriosis, or removing an ovarian cyst, or other similar types of procedures, we would advise that you take acetaminophen, also known as Tylenol, with an anti-inflammatory, like ibuprofen. And you take both of them together regularly for the first couple of days. If you stay on a regular schedule, whether it be every 4 or 6 hours, you're going to decrease the inflammation and be on top of the pain. And that way you can avoid the other pain class medications called narcotics. Now we're trying to reduce narcotic use because they have side effects. They can cause constipation, and in some patients they can lead to chronic dependence. So focus on the acetaminophen and anti-inflammatories. And in most cases, you don't even need to have a narcotic prescription. Now, if your pain is getting worse and is out of control, then call your doctor. It could be a sign that there's something else going on. If you do need something stronger, like a narcotic, then use it sparingly. Only use it when you need it. Don't take it regularly if you don't need it. If you do have needs for narcotics or medications that lead to constipation, then consider using a stool softener. Often after surgery, the bowels may slow down and you might become constipated. So stay on top of your fluids, your high fiber diet, and in some cases, just go ahead and take a stool softener or an agent that'll help move things through the bowels. So in summary, it's all about anti-inflammatories and acetaminophen together on a regular dosing schedule after your surgery. Avoid or use narcotics only sparingly, and watch those bowels. Hopefully that was helpful, and we'll see you at our next video.